Whether you're looking for answers to specific life questions or simply hoping to become the best version of you possible, welcome to the Mental Breakdown and Psychreg podcast, where we offer insight, information, and strategies based upon research and years of practice as psychologists. So sit back, have a listen, and get connected with our hosts, Dr. Berney and Dr. Richard Marshall. Welcome back. Today, we're going to focus on symptoms of depression, but more specifically, we're going to talk about the way in which symptoms of depression change over time. Because at different ages, depression presents very differently.
That's right. We talked yesterday about the symptoms,
right.
The complexity of it. And we were saying that these are the typical things you need to see in depression. But that's in sort of the typical adult.
Right.
The problem that you discover as you dig more deeply into depression is that the symptoms differ based on age.
Right.
So that the typical symptoms we see in the Diagnostic and Statistical Manual, or according to that little acronym you have.
Right, SIGECAPS.
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 And that's a way to remember the symptoms. It's an acronym to remember the symptoms. SIGECAPS.
Right.
And this is how you would teach the residents in psychiatry how to remember the symptoms.
Right.
Okay, because it's a long list in the DSM. And so you have these symptoms, but these are the symptoms that typically appear in a typical adult presentation. And what you discover as you dig more deeply into depression is that young children and adolescents and the elderly depression looks different in those different age groups.
Right. Yeah. So when we typically think of depression, we think of that. We typically think of the symptoms in adulthood. And so, yes, we have SIGECAPS, so SIGECAPS. So the first S is sleep, so changes in sleep pattern. The I is interest, so changes in interests or, that
you're not interested in things
anhedonia types of things that we were talking about yesterday. G is guilt, so feelings of guilt or worry. E is energy, so changes in energy, you feel more fatigued. The C is concentration, so you're having difficulty concentrating. A is a change in appetite. We talked about that yesterday.
Not activity, it's appetite.
Right. P is psychomotor activity, so that's the movement.
Movement.
Become more either more fidgety, more restless, or you become catatonic. You can not move at all. And then the last S is suicidal ideation.
Right. Life is so bad that maybe there's a better alternative.
Yeah. And I think that suicidal ideation is the way that we have traditionally looked at that last S, but now I think it's just self-harm as well, because we see that in significantly increasing rates nowadays.
And cutting, we talked about that a few weeks ago, that cutting is appearing in children at younger and younger ages. It used to be something that we typically thought of as something that teenagers did, and now we're seeing an increase in cutting, a fairly significant increase in cutting in preteens.
Right. So those are the typical symptoms that we think of in adulthood.
Right.
And again, those are sort of the classical symptoms of depression. But depression in children can present very differently. And there are studies that talk about the assessment of depressive symptoms in very young children, even infants, where they're just not as engaged, and it's not an autistic spectrum type of disengagement. It's a depressed type of disengagement. So we have some of these symptoms presenting in very early ages. But generally speaking, in childhood and even adolescence, depression can present in ways that you don't think of as depression. I think that the most important one is irritability, agitation, anger. Certainly depressed adults can present as angry as well, but it's almost characterological. I mean, it's almost a characteristic of depression in children and teenagers, where there's this anger and sometimes even rage that comes out that's rooted in depressive symptoms.
Right. When you think about depression in adults, yesterday we talked about how complex it is, and it might just be a reaction to an environmental event, or it might be, a chemical imbalance. Could be any number of things. But when you think about the reaction to an environmental event, an adult at least has some control. Mm-hmm. A child has no control. Typically has no control over their environment. They can't just walk out of the house, or they can't change schools, or they don't do these things on their own. And that feeling of impotence can easily lead to depressive symptoms, because life events affect children as well. But children can't do much about it.
Right.
They have to sort of grin and bear it. Mm-hmm. And so the symptoms, it might be the same cause, but the symptoms are very different in young children and adolescents.
Right, right. And so when we look at, sometimes we'll get referrals for kids, and we have to look at whether they have ADHD because they're not attentive. And usually it's ADHD, predominantly inattentive type, that people are thinking about. Oh, well, he's not hyperactive or impulsive or anything, but he's just not paying attention, not concentrating or focusing. And depression is one of the things we have to rule out, because we have that difficulty concentrating as part of it. Something that we can see in childhood and adulthood, but especially in the elderly who are very depressed, as we see sometimes profound memory deficits, memory impairments as a result of depression.
And you think of it, most of us, our first thought would be dementia.
Right.
This is the old onset memory loss. I'm getting those sorts of symptoms. When it may be depression, over some other event, certainly the loss of a spouse.
Right.
In fact, Barbara Bush's funeral was earlier this week.
Right.
And the next day, her husband of 60-some years ended up in the intensive care unit of a hospital. Right. And so that's not atypical, that long-term relationships end, and not surprisingly, people slip into depression.
Right.
So it's not dementia, it's depression causing the memory loss.
Right. Yeah, I remember one of my first jobs in mental health was at the hospital. We had a memory disorders unit.
Yeah.
And we'll talk about this a little bit on Saturday, but one of the most intrusive, one of the most extreme treatments for depression, especially non-responsive depression, is ECT, electroconvulsive therapy. Right. And we would have elderly patients in the hospital, and they would appear demented. They would look as though they have profound dementia, but it was depression such that, and their depression didn't respond to medication or regular forms of treatment, so they would undergo ECT. And it was amazing, because ECT can be very effective with depression at times. And it would be that catatonic type of depression, the confusion, really poor memory. Right. They go for an ECT treatment, they sleep the rest of the day and night, and then I see them the next time, my next shift, and they're up walking around and talking, and everything appears fine. And it's really amazing, when you can manage the depressive symptoms, when you can manage that depression, the changes that it makes in the person's life.
Functional changes.
Yeah.
Just incredible. Right.
Yeah.
Yep. But, ECT has such a bad rap because of TV shows that show the old way of doing it.
The way that it was done before, I mean, it's very different now.
Very different.
Yeah. And again, we're going to kind of get into some of those kinds of treatments on Saturday, on Saturday's podcast. But a few more a few more symptom related issues is, and you probably have seen commercials that talk about pain, the pain associated with depression. Many times people with depression will experience physical pain in their body.
Right.
And we have medications like Cymbalta, for example, that was created, interestingly, specifically for some of those pain-related symptoms associated with depression. They're not diagnostic, but they do present pretty often.
And that's one of the common complaints of teenagers and youngsters who are really depressed, they'll start to complain about various aches and pains, which is unusual in children. Children don't typically get aches and pains unless it's something related to growth. Those things. But so in children, adolescents, the first thing is you could have memory or attention deficits. The second is the appearance of pain, and another is fatigue.
Yes. Fatigue, and that's part of CG caps, the energy part. But yeah, you feel like you don't have very much energy. You feel tired all the time and not really wanting to do things. The most concerning symptom, and I think that I know that I was very surprised when I saw what some of the research said about this, but some of the biggest, some of the symptoms that should raise the most concern, the biggest, isn't sadness, isn't even really anhedonia. It's feelings of hopelessness and feelings of worthlessness. Those symptoms, again, they're not diagnostic, but they often associate or accompany depression. And when those symptoms are present, that's when you really have to have some concern and get help. Because as soon as you start feeling hopeless and worthless, that's when the depression is getting to the point where you really need some support and help to get through that.
That's right, to dig yourself out of it.
Because what comes along with that too is pessimism. It's never going to get any better. Aaron Beck talked a lot about sort of those cognitive distortions, and that's where his whole cognitive behavioral approach to therapy came from. It is dealing with those automatic thoughts that are sort of global and specific and used to almost used to harm yourself, because I'll never succeed, I'll never get any better, and those kinds of thoughts, again.
That's right. Young people typically have energy. I mean, you just associate energy. The younger the child, the more the energy. Some teenagers start to slow down a little bit, but typically they're able to stay up late. They're able to go. And when you see this fatigue, especially when it goes on for days or weeks or months, could be a cause of concern, because they shouldn't be that tired all the time. So be careful with that. It's like pain. You shouldn't be feeling pain.
Yeah, absolutely. So again, depression is very complex. There's a lot more to it than just being sad. There's a lot more to it than just not feeling great.
And for parents who are concerned about their children having being depressed or having depression, make sure that you understand that there are some other symptoms that could be occurring in your children or adolescents.
Absolutely so. All right. That is it for today.
Wait, one other thing.
One more thing.
It's different in the elderly. And so the main thing there is the memory we were talking abilities. About. What else would be affected?
I think that most of the same things that we talked about with the others, except the same thing with physical pain, the same thing with fatigue and concentration and memory issues and suicidal thoughts and all that kind of stuff.
So make sure that you don't jump right to depression, right to dementia. Okay, and I think that's the fear with the elderly, is that we jump to dementia. And then your example of the ECT, you think how quickly everything changed. So be very careful. If you have children or teenagers, or you're taking care of an elderly relative, keep in mind that it might be depression and not dementia.
Absolutely.
In the elderly, and it might be depression in teenagers and not just
angst.
Not just being a teenager.
Okay. Absolutely so.
So all right.
That's it for today. Tomorrow we're going to talk about biological roots of depression.
And I promise to keep him in line.
It's going to be a great talk.
He'll want to go on and on about that. You know how he is. He'll want to go on and on about the biological stuff. But I'll do my best.
Until next time, stay happy, stay healthy, and forget to be afraid. Thanks for sharing this episode of the Mental Breakdown and Psychreg podcast. Be sure to check out the show notes for links to follow us on Twitter and subscribe to our YouTube channel, where you will find all of our previous podcasts and much more. We would be honored if you would become a patron through patreon.com, where any donation you can manage will go to the development and creation of more content. Just visit patreon.com/thementalbreakdown for more information. Thanks again for listening. Have an awesome day, and we look forward to being back in your feed tomorrow morning.